So welcome everyone to our first of our Australian FASD Guidelines webinar series, where we will be focusing on simplifying FASD diagnosis with AI for professionals. And I'm Viv Lyle, I'm the project coordinator for the Australian FASD Guidelines. And presenting this webinar today is Prue Walker, who's a senior social worker and FASD consultant. Prue has extensive clinical experience in diagnostic services and specialises in interpreting complex reports for families, schools and service providers. And Prue was also directly involved in the development of the new Australian FASD Guidelines. And excitingly, she's also joined by some wonderful panellists that we have. First, we have Associate Professor Delise Hutchinson, who's a clinical psychologist and NHMRC Leadership Fellow in the Strategic Research Centre for Lifespan Research in the School of Psychology at Deakin University. Delise was also directly involved in the development of the new guidelines, and she'll be providing some feedback on the usefulness of AI in clinical and research contexts. And we're also joined, excitingly, by Dr. Annette Connolly, who's a paediatrician, and Dr. Julia Shackleton, who is a clinical neuropsychologist, and they're both situated at FASD Connect in Monash Health, where they both provide assessments for children who are exposed to alcohol before birth. And Annette and Julia will both be providing feedback on the usefulness of AI for clinicians. And finally, we're joined by Nicole Hewlett, who is a proud Palawa mother whose work centres on knowledge translation that is healing-informed, strength-based and culturally grounded. And she is a member of the Australian FASD Guidelines Development Group and is also in the final year of her PhD, which is focused on the development and translation of Australia's first Indigenous framework. So Nicole will be providing feedback on the quality and usefulness of AI for Aboriginal and Torres Strait Islander families. So this webinar is very conversational and will be very interactive, and we really encourage you to submit your Q&A, your questions into the Q&A panel. And also along the way, please be interactive and rate the AI responses. I've given some examples of how to do that, but basically something like a shocked face for not so great, a thumbs up for it's looking good, or a heart for if you think it's excellent. So please get involved, and and at the end I'll also provide some information on how you can keep up to date with everything. But I'll pass it along to you, Prue.
Thanks, Viv. Thank you so much for that introduction. I'm very excited to be doing this today. It's quite an interactive experiment, if you like, in how we can use it. And we'll be doing some live, AI queries and really looking at, how good are the results. Viv's mentioned putting some reactions in. Viv, if you could put them in the chat again, because I think they've only gone so far to the hosts. So if you could send them to everyone, that would be great. And I've put a thing in the chat to feel free to introduce yourself in the chat. When you post in the Q&A, it's only us that can see it. If you want to post things in the chat, everyone can see and comment on that. And we've got people who've booked in for this workshop from all over Australia and some international colleagues as well. So very excited to have them present. They might be asleep and planning to watch this recording. We will be sending everyone the recording at the end. It might just take a little while to get it all uploaded and hosted. So let's move on and start our workshop. So we're going to be, the topic of this workshop is how we can simplify the FASD guidelines as clinicians or professionals working in the FASD space. I'll just start with an acknowledgement. We want to acknowledge all the First Nations people of all the lands that you're on today. We want to acknowledge the enduring knowledge and connection to country of all First Nations people. We want to honour the wisdom and pay respect to elders past and present, and also future leaders working alongside elders. and we recognise all First Nations people as the original health practitioners of these lands. Particularly important in FASD to acknowledge their role in continued supporting their communities and navigating complex health issues. So in this session today, we're going to be looking at how AI tools like Chat or Copilot can support professionals when they're using and interpreting the 2025 FASD Guidelines. We will talk a bit about some of the limitations of AI and how to get the best results possible. We'll be doing quite a few different demonstrations, and we'll welcome people to put in Q&As or comments in the chat as well if you would like us to ask particular questions. And we'll also talk about how we can make sure that how we use AI is safe, ethical and efficient. In the chat, it would be great to hear who's used AI before. I think as you know, the more I talk to professionals, the more I'm hearing that people are using AI quite a lot, probably in their work. I know when we look at things like Chrome browsers, it's kind of built in now. You get an AI response regardless. But it'd be great to hear, you know, what people are doing and how they might be using that. Someone's raised a hand. Are people able to write in the chat? I'm wondering if there's any problems there. If there are, please let us know.
Yes. In the Q&A, someone said the chat's disabled. Can we enable it?
Okay, I'll ask Viv to have a look at that in the background. I'm very sorry, we did set it up that it would work, but we haven't done a webinar for on this platform before. So I'll leave that with Viv and hopefully we'll be able to fix that problem very soon. So we'll wait to hear a bit later how many of you are using AI, but I'm guessing probably quite a few of you have used it. If you're like my colleagues, there'll be a couple of people that are really into it, a couple of people that are, you know, a bit dubious. A few people might have used it and found it, you know, helpful, but then not that helpful. And a lot of people that I've spoken to feel like, well, I probably could be using it more, but I'm not really sure. And I've got some concerns, so I don't quite trust it yet, which is all very valid. When we think about the new guidelines, there's quite a lot to take in. Now, I'm just checking that you can all see my screen because I can't check it, but yeah, you can. The new Australian Guide to Diagnosis. Oh, good, the chat's working. Excellent. The new guidelines are more complex and also less prescriptive than the previous guidelines. We still have a diagnostic algorithm. You can still go through quite clearly the steps required in a FASD diagnosis, but we have included a lot of supporting materials and a lot more information, you know, good practice statements and things like that, which takes a lot of time to digest. These guidelines, I think, put more emphasis on the process of assessment, how we work with families, how we use a cultural framework, how we can do assessments in different settings. So, but naturally it becomes more complex because we're not just saying this is how you do the assessment, we're saying these are the things that you need to consider when you're planning or doing an assessment and when you're giving feedback to people. So what is the role for AI? I think people are, you know, as I said, got lots of different views. Can AI really help us with some of our clinical questions or not? And this is something we need to sort of think through. Some of the benefits that I can see are AI is very good at summarising information quickly for doing it for a particular audience, tailoring it to different audiences, different levels of English proficiency, different cultural groups. It can manipulate language very quickly. It can be really accurate when we give it specific prompts, when we give the reference source material, when we tell it what to learn from, and when we don't stretch its limitations. And I'll give you a couple of examples of that. It's also really responsive. You can reword information for tone, audience, or level of complexity. I was working with a group of foster carers, and I used AI to write a letter to the school about their child with FASD, and it was a little bit too like telling them what to do. So I just put in chat, can you make it not so much telling them how to suck eggs? And chat went, sure, I'll make a more kind of, you know, a more humble version with gentle suggestions rather than you need to do this or you should do that. And so it knew exactly what I meant and it changed its tone instantly. So this is one of the things that can be really good about it. But obviously there's concerns. Sometimes it just makes things up. How can we really trust it? Do we really trust what it tells us? Where's the information coming from? What if you upload something with client details, something confidential? Or is it what's it doing when we give it things? Where does it store it? What does it do with it? It always sounds very confident, even when it's wrong. And it doesn't always get the nuance. So I guess the first thing to think about is that it can help us navigate the guidelines that, what has been written. It can help us navigate through that document pretty effectively. It's not going to help us diagnose, although I'm sure there are medical people using it for that very purpose right now. But what it can do is it can find sections very quickly. It can clarify things if you need something explained a particular way. It can pull out information for someone based on their role or their setting. And it can help explain how to apply things in different settings, but it's never going to replace clinical reasoning or diagnostic decision making. Sorry. Something to know about AI is they don't just search for information, they interpret language, these AI models. They look at patterns and relationships between language, between information, and they're really good at turning dense stuff into structured summaries or explanations, like I said, for different audiences. But how good it is often depends on the tool and the question. The main tools that I use ChatGPT as my primary tool, but not for client information. Copilot, many of you may have access to that in clinical settings, and I know at Monash Health, it's part of our Microsoft suite. Information stored in Copilot is stored according to Australian Health Guidelines in Australia on Australian servers, and at Monash we have full permission to use it for any clinical information. So that gives us a sense of security that has really been thoroughly explored. With ChatGPT, it's perhaps less so, and I'd be less inclined to I wouldn't be putting private information into that. But sometimes I actually prefer the responses of chat over Copilot. So prompts are obviously the most important thing. What prompt we put in gets us the best results from AI. Excuse me. And a prompt is any instruction, question that you give it. The tips that I would say are be specific and structured. So tell it what you want, who it's for, and what format you want it in. Write a 200-word summary for a case conference. It knows what the audience is and it knows what sort of language to use. It works best if it knows who you are and what your role is. Now, when I give you some samples, my chat, I have a paid version. It knows me and it knows what I do and it knows my tone of voice. So I'll get different results to you using that, even if we put the identical query in. And often it will say, do you want me to develop a training resource around this? Because it knows I do training. You're probably not going to get that same response. But it has learned what I want. So, for good or bad, I think you can type things in, but you can also use the microphone. And sometimes that really helps. Sometimes I've sat with someone and said, just describe what's happening. And they'll just give a bit of a description of whatever's going on. And AI can work with that very well. You don't need to type everything in informal language. And you can also get it to refine it, like I gave you with that example with the school. If the first response isn't right, tell it what tone is wrong. Tell it what it's getting wrong, so it can and it can change really quickly. What we find is that you can get a really good answer to a very simple prompt. So I'll give you this example. I'm an educational psychologist. What do I need to know about the FASD guidelines? But you can also ask AI to write you a prompt. This one is, I'm an educational psychologist. I want to know about the FASD guidelines, which includes doing assessments in a primary school. Write a prompt for me to get a good summary. So if I might wait and I'll swap over to AI in a moment and put some of these things in. But when AI writes you the prompt and then you use that prompt, you get a different, more nuanced sort of response. Having said that, I'm finding that as we go through this, AI is already predicting what you want to know, and often the first result is still very, very good. Accuracy, how accurate is it? So AI looks at patterns of information, but it doesn't really look at the truth. It can sound very confident, even if it's missing information. The paid models have more reliability, and they have larger context windows, which I like to think about as working memory. So they can remember and hold in mind more information, including if you upload a document, they remember more of it for longer than the free models. So sort of the more you're paying for these things, the more brain you're paying for. Free models, so the free version of ChatGPT has a very short working memory. It's like you give it a phone number and it can ring the thing and then it's forgotten what the number was. So how to get the best out of that is you just ask 1 or 2 or 3 questions and then you start a new chat. Hallucinations, this is when it invents things to please you. And I can't tell you the number of times I used to hunt up references that didn't exist. You'd even get to the journal. It's a real journal. It says page 75 to 85, and you go to page 75 and you're midway through an article on a completely different topic. It's totally invented and it's very frustrating. I find this happens a lot less with the paid version. But you would never rely on any references created by free chat. And even the paid version, you really have to check everything. But there are some ways that you can do it. I can't remember if this is covered on a later slide. Here we go. When you upload a document and you say in the prompt using only this uploaded document, then you get very good information. It's very accurate. If you ask 3, 4, 5 follow-up questions, the accuracy will change. It can drift back. So I've done this where I've uploaded the guidelines, and then after 4 or 5 questions, it starts talking about the old guidelines. And I know that because it will talk about 10 domains instead of 9 domains. Now, that's not happening in the paid version, but it does happen in free versions. So it's just something to keep an eye on. One way that ChatGPT 5, for example, has a deep thinking mode, and I find that mode is really good for research. And one way that I've tested it is to say, choose a topic that you know a lot about. I've done this with a few people where I've said, summarise recent Australian research in the FASD field, or summarise current research in FASD in First Nations communities, and you look at the results, and if it's your area of knowledge, you can see that all the key articles are actually there. The research is real, the links are real, and so that helps you figure out how trustworthy your model is, really. Test it on something that you know a lot about and see what it does. You can also tell Chat what tone to use. You can give it, descriptors. I want it to be objective. You can tell it what to avoid. You can tell it, sometimes you can tell it what you value. Like if you value, scientific evidence over something else, tell it that, and it will write you a response that talks to what you're looking for. Do you know what I mean? If you value, it sort of brings its own values. If you do upload a report about a child, for example, and ask it to summarize it, it will automatically give you a strengths-based response. That's because it's learned that the majority of practitioners want a strengths-based response. If you need something different, if you're fighting for a child's funding and you actually want to write a report that highlights the impact of a child's impairments, you might need to tell it to write in that tone, because it will default to what it thinks you want to know and what is going to please you. Something that can be really good to do is to upload something that you've written that you like the style of and say, write in this style. You can also upload something that you've written and say, how do I describe this style of writing? And it might say, this is, professional, polished, or it might say, this is analytical, or this is conversational. And then you can use those words when you're writing your next thing. Ask this question and answer in a style like this. That is conversational, professional, whatever adjectives it's given you. I mentioned earlier, it's really important to understand the memory and the limits, because even the advanced models will forget things after a while. You might need to restate your instruction, just using the uploaded document. If it starts to drift, you would start a new session and re-upload the document. And don't go back to old sessions, because it won't remember the documents that you've uploaded. It can still look at the chat above it. And for example, with ChatGPT, you can start a new chat and you can say, with reference to the chat, and use the title of your chat. But like if you've uploaded that document, it's only going to remember it for that session while that session is live. I've probably mentioned this. Another way to check things is to ask it to what are the sources, or provide page numbers as you go along. Asking it to do page numbers can be really helpful, or provide exact excerpts. Now, this is one thing I think even the paid models are not good at. Chat will invent quotes, so you cannot rely on it unless you work hard and test it. I did this with a couple of things, and maybe I let the chat go on too long. Maybe I uploaded it too many times. It could be user error, but it wasn't giving me really accurate quotes. What it can do though is you can go back and say, where exactly is that quote? And it will say, oh, I'm sorry, that quote is not actually there. But I would never, this is what I've learned just from practice, is never rely on it for quotes. I don't know why it can do references better than it can do quotes. I do not know. Okay. Are there any questions before we go on and have a bit of a demonstration? I'm hoping that the chat is working for everyone now.
Prue, we had one question.
Oh, good.
That I answered actually. Just clarifying if there's any copyright restrictions with uploading the guidelines to AI.
Look, I don't believe so, because the guidelines are available on a public website and anyone can trawl that website. Chat is going to trawl that website anyway. Now, you might think, well, it's concerning. What's Chat going to do with it? My personal view is the more Chat integrates knowledge about the guidelines, the better, because I think it knows a lot more about FASD than it used to. And a couple of years ago, I would put things into Chat like, tell me what are the main neurodevelopmental disabilities for children, and it would give me a list, and I would go, you've missed FASD. Oh, we're very sorry, we won't do that again. I'll say, give me a list of the most common disabilities. It would leave it off again. I would say, you've left it off again. Oh, I'm very sorry, I'll make sure I include it next time. Now, I don't know how long it's going to take, but eventually it's going to start including it. And so my thinking is, this is open information, it's in the public domain. One of the main things I think with AI is if something's written by AI, you can't copyright it. It doesn't belong to you, it belongs to AI. And that is the same with images as well. You can't trademark an image or copyright an image that AI created, but you wouldn't want to, because the images are pretty terrible. Well, not all of them, but I don't mean to be judgmental about AI. Sorry, AI, if you're listening. Any other questions? Okay, I'm going to click over now. Oh, see, it knows me. Good to see you, Prue. It's so friendly. We've got to keep it on our side for when it takes over the world. Always be polite to AI. No, I'm kidding. Okay, I'm going to start out with a pretty simple question that I've prepared earlier. I'm going to ask it to, actually no, that's a hard one. I'm going to give it an easier one. I am going to say this one, the one that I started with here. I'm an educational psychologist. What do I need to know about the guidelines? Now I haven't uploaded it, but because I've uploaded it so many times before to Chat, it actually knows what I'm talking about. So this is they've made a summary for practical use in schools and child development contexts. It describes your role. You might be identifying, assessing, supporting. You might be in a diagnostic team. You might be in community settings, or you might be collaborating. It describes some of the domains that are within your scope. It talks about here, it's gone to educational and clinical psychologists. So not all educational psychologists might be assessing all of these. And look, it's snuck language in there, which I'm like, it does, you obviously do have a role in language, but we would also look at speech pathology there. It's given a definition of impairment and diagnostic thresholds. It's talked about how to document and interpret findings. Talks about the functional impact criterion C. Then it discusses, you know, the need to do this comprehensive formulation. It's not just the test scores. Gives you some ideas about how to engage families and explain it. You might have a role in supporting schools after a diagnosis, adapting environments. It gives you some guidance around supporting Aboriginal and Torres Strait Islander children and engaging cultural advisors, health workers, and being alert to some of these factors. So that's important. And then it's got some information here with good links, good Australian links. So this is one example. I'm going to, before I ask anyone to comment on this, I'm going to put the second option in that I developed, that I showed you on that other slide, where I'm going to ask AI to write me the prompt for this. Okay, so now this prompt is going to describe my role. So I'm not going to read it all. I'm just going to paste that in as a prompt. You can read it all later, and we will give you a printout of any of this that you would like. So I'm going to put this in, but what I'm also going to do is I am going to put the guidelines in. I'm just going to use the diagnostic. Now I'm going to put the full guidelines in. The full guidelines takes more kind of energy than partial, but I think for this test environment, it's fair enough. But environmentally, we want to upload the smallest things that we need. Now it's finishing its loading. Okay, and it's ready to give me the answer. So rather than go through, you know, how accurate that answer is, we're just going to use this to compare the types of answers you get when AI has written you the prompt. So we've got a similar discussion of role, neurodevelopmental domains. It's actually not much different. It's almost the same. I have put this in earlier and got quite a different role, a different description. So I might say, can you write this as a guide for use within a primary school? Doesn't even care about my spelling mistakes. So smart. So this is now going to format this as a practitioner guide, and it's going to take a different tool. So we've got the areas of assessment. We've got thresholds. We've got documenting findings. It's still pretty similar. It'd be interesting to see if you each put something like this in, whether you're going to get similar or different results. But do any of the panelists want to comment on the sort of accuracy and reliability? We haven't sort of rehearsed this particular scenario, but you know, how useful do you think this is? And please rate it in the chat. Thumbs up if it's okay, heart if you think it's really good, confused face if you think, oh, I'm not sure. And scroll down if does anyone want to comment on that of our panel?
I can comment from a neuropsych point of view. I don't think it did such a great job, Prue. I think
Yeah.
you've probably shared examples where it's done better, and I wonder if I think it's got a bit confused by the school part. I think it's like
Yes.
it's focused much more about language, and then
Yeah.
it's gone to comprehension rather than
Yes,
in the
you're right.
FASD guidelines. We absolutely think about language more as communication.
Yes.
So
I think you're right, Julia. We have got better results with other questions.
yeah,
I'm actually glad we've had one at the start that's not that great, because it is all about how we apply our judgment to this. I'm going to put another question in, which I think will be a bit more interesting, and I'll ask you to comment on this one, Julia. So I'm going to ask it to, I don't want it to write the prompt. I'm just going to put the prompt in here. This is I'm going to pretend I'm a neuropsychologist because it knows I'm not. So I have to tell it I am, pretend I am a neuropsychologist. Oh, sorry. It's good at pretending. Using only the uploaded Australian FASD diagnostic guidelines gives specific advice to my role in the diagnostic process. So it's already using a lot more of the guidelines language in terms of choosing the criterion B, and formulation of the child's profile. It talks about the role. I think that's probably pretty straightforward. It talks about FASD being both an etiological diagnosis, linked to the prenatal alcohol, and a functional one. Neuropsych's role is to operationalise this by defining the child's functional and neurocognitive profile. I love learning these things. So, domains that are within your scope. What do you think of those, Julia? Do they look accurate to you?
yeah, I think it's done a better job.
Yeah.
Yeah. I think that's a little bit better. But we'll keep scrolling down and see.
It's got communication motor skills, which, shared with speech pathology. I'm not sure, would you say that communication, I suppose your cognitive assessments do assess domains, but they don't fit under the communication domain. Feel free to chip in too, Delise.
Yeah, I mean, I think it has done a better job here. I agree with Julia. And I think I like how it sort of pulled out the key criterion that you would be focusing on, kind of narrowed that down so that you can hone in on that. I feel like a lot of people probably might be coming in at this stage with the new guidelines thinking, what are the guidelines? And wanting to learn about the broader guidelines. But for those like Julia or I have a speciality in a particular area and are kind of wanting to say, well, where's my focus here? I think it's really useful because it's such a big document, right?
It's huge.
I've got a printout of it. And it's, it's a big booklet. So it's really helpful to just do this. But I do agree, kind of going back to what you were saying earlier, obviously cross-checking key things is important too, right? To be sure. But it kind of is almost like an iterative process in a way, isn't it, where it sort of helps you draw out and extract the information you want, but then cross-check the accuracy of that as you go, I think.
That's right. Yes, exactly. I'll scroll down a bit further. So the definition of impairments, that looks okay. Clinically significant, it's using the right wording. It's got the severe and moderate range. Avoid reliance on a single score. I mean, it's fairly brief, but it's good. You could, if you wanted more detail, you could go back and put a prompt in and say, expand on this. Determining clinical significance and functional impact. So this is, how do we link these to criterion C? It's saying that neuropsychs should describe how their difficulties translate, integrate collateral information. And also, I think this is good. Distinguish these from the fundamental impairments from sort of secondary effects due to abuse, neglect, etc. What do you think about that section? Is that reasonable?
I think it's good information,
Mm-hmm.
but I think if I was a neuropsychologist that didn't know how to assess FASD,
Yes.
I don't know that I would get the information that I needed to go, right, what do I do?
Okay.
I think it's good, like a summary of understanding, but I don't know it's
Yes.
giving me great,
Okay.
yeah.
So what if we wrote a prompt more like, can you provide a guide for a neuropsych to undertake their component of a FASD assessment? Let's see if it gives us something more targeted here.
And I actually think a good example of a prompt, Prue, was the one that, and here's where we all find out that Prue's done actually lots of background work for this talk. It wasn't all done on the fly. Is that really detailed prompt that you
Yes,
circulated
you're right.
earlier? So I think that's a good example of a good prompt.
Yes.
It tells it what to include. It tells
You're
it what
right.
not to include. And
I
it's
shall
almost,
put that in now. Yeah, good
'cause
idea.
I think that's a good example for other people, because you could adapt it for your, I guess, clinical specialty as well.
Yes.
And you'll see how detailed it is and long. And I think that was actually pretty good. What came out of that one?
Yes. No, you're right. Thank you, Julia. And this is the problem of me having like 4 different windows open and trying to remember what I've prepared earlier. So we did prepare this prompt earlier, and AI actually helped me write this prompt. So again, using only the uploaded guidelines, we want advice specific, exactly what Julia described. And what I'm going to do is I will add just chapter 4 here to refresh its memory about what is uploaded. This is only the diagnostic chapter, so it's not going to pick up all the other contextual information in the guidelines. And for those of you who are not neuropsychs, bear with us. We'll be moving on to other things soon. So it's thinking, it's reading. This is good. It's taking a little bit of time. I like that. It might have moved to its deep thinking mode here. Now it's a bit slow. What's it doing? Oh, so if you click on thinking, it tells you what it actually thought about, which is kind of fun to see its brain. And now we're getting a more detailed overview of the domains. It's giving you notes about things to consider. I'll let you sit on that just for a moment on this page. I'm only really skim reading from my point of view. We've got a section here on what impairments mean and what thresholds are.
And I think, Prue, you can already see it's being more accurate, because it talks about how, this domain sits outside your scope, but you might want to think about it contextually. And so that's
Beautiful.
like if you're a speech pathologist, or if you're an occupational therapist, you could almost copy and paste your profession into that prompt and work out, right, which domains do I need to really assess and which ones do I just need to think about. And so I think that's be helpful.
Yep. Then it gives us guidance. We won't go through all the details of this, because I know that not everyone in the audience will be a neuropsych, and you may be thinking, okay, I'll let someone else do this part of it. But I think, the point, I guess, is the level of detail is actually pretty good. Now, if I was working in a diagnostic team, I might print this out and share it with the team and go, let's use this as a starting point to write down how we're using the guidelines. And then your team bring their brains to it, their human brains, and go, I like this, I don't like that, it needs to be more this. And then that can lead to you creating a resource for your own team that is way quicker to write than if you did it yourself, but also not just AI generated, but AI really as the basis for improvements. And it's offering a checklist. Now, often what it does is the checklist, the more you go down the thing, the less good some of the answers are. Sometimes I want it to go back to an earlier one. I'm just going to try another prompt here. So I've got so many prompts over on this screen. I'm going to ask it, one of the questions that we have talked a bit about is, I'm going to need to upload these guidelines again. Because we now have the criterion C that looks at, you know, functional impact across domains, as well as adaptive skills being one of the 9 domains, I'm asking it to explain the difference. What's the difference between this domain of impairment and this criterion C that also is functional impairment? I'm going to say answer into 200 words or less, so it fits on the screen. So I think that gives quite a neat overview. Any comments? Delise or Julia or Annette might want to chip in.
I really like the, you know, just as a, you know, busy kind of practitioner, you kind of don't have a lot of time. I like that limit that you use of, you know, refrain it to 200 words just to get that really high level quick. Yeah. I think it's quite, you know, it's really accurate in pointing to, you know, this is a specific sort of subdomain. Criterion C is a much broader overall category that we look at. So yeah, I think it's quite accurate.
Right.
Mm.
I'm going to give it a follow-up question, which is, what happens if a child doesn't have clinically impaired skills in the adaptive domain, but does have other areas of impairment? So if they don't score in that adaptive domain, what does that mean for criterion C? They still meet criterion B and C, as long as their overall pattern of impairments results in functional difficulties that require significant supports. This is quite a good description, I think, really.
Yeah, I think it's a really good description.
Yeah.
And I think it's how we often explain it back to families is that it's when the domains of impairment accumulate for these kids, when they kind of snowball together, that's why you get this big functional impairment for criterion C. This is why they're struggling.
Yeah.
So yeah, I think that's a nice way of explaining it, especially to clinicians who aren't familiar with the criteria and who maybe are struggling to get their head around the difference. Because I know, you know, earlier this year, I think we were struggling to get our heads around it. So I think that's a nice little summary. Yeah.
Right.
Also, I think, Julie, yeah, just the, you know, the feedback that not every area has to be impacted. It may just be a couple of other areas where those impacts are being more seen and observed and you know, leading to poorer outcomes for children. So I think that's really clear. Yeah. And nice and short too, again, which is really helpful.
Yeah, keeping it short can really help. I'm going to put one more prompt in here before we go into a few other things. And this is one I'll ask Annette to comment on. So I've written that I'm a paediatrician in a community health setting. I want to know what parts of the guidelines are relevant to me. What can I do? I see kids who might have FASD and I do developmental assessments, but I'm not in a clinic and I don't have psychology, which is probably what a lot of people have in their situation. I'm going to say keep answer to 400 words because otherwise it is getting too long to scroll through. So it gives us a bit on identifying and initiating assessment, definitely recognising those developmental behavioural learning difficulties, gathering information on PAE, and looking at the 3 sentinel facial features. Annette, feel free to comment at any point.
Just go down a bit further, Prue. What else has it told us?
It gives us an overview of the assessment.
Yeah.
In limited settings, you can get advice on your formulation, which is probably a good option.
Yeah, good. So where this would be, can I give a tiny bit of background? So I graduated as a pediatrician about 15 years ago, which means my entire training was completely FASD devoid. So I think there were a page in one textbook. So most peds of the new batch coming through have heard a bit more, but I'd say it's certainly Australia-wide that my gen of pediatricians had very little knowledge about FASD. Most of us now know, so obviously I know because I'm working within this setting. However, generally now, I think most peds would know there's something called FASD and that it probably exists. Many peds are well on board that it exists, and have probably caught up that we have 2016 guidelines that were updated in 2020. If a ped in the community is prepping the night before or that morning saying, I've got this kid, the referral says that they've been exposed to prenatal alcohol. Oh my gosh, new guidelines, they're 280 pages. This would be ideal because then it lets me go, I haven't got time to look at that guideline. I can pick the teeth out of it. And because, I've made peds sound silly, we've got some training in most of this stuff. So we could look through and go, oh yeah, I would have done that. Yep. Oh, interesting. Yep. It would give a framework to start with. What I would want, I like how it gives a bit of a overview at the beginning of new guidelines and the framework of what I'm going to be expected to be doing. And you said before that it can ask for page numbers, because I would want for the ones that I don't, some of them it's, collaborate and seek supervision. Yeah, that's cool. That's clearly true. But for some of the stuff where I want to check it, it'd be helpful to be able to flick, particularly maybe after the consult, and to make sure I'm following the guidelines well. There we go. See if the page numbers will come up.
So this will be a one-pager that it's going to give us now. Role and scope, criteria. Not too bad.
Yeah, good. Quick,
yeah.
Gutsy, ties together, and really useful for because most people will go into it going, I think I know what I'm going to ask, but there's probably 3 or 4 things in there I'd say that you'd go, oh, must cover. So that would be very helpful. And I like that it said you don't have to do this all on your own. You're really, like all of us, you're really important little bit of this process, but don't feel like you're carrying it all. There are other places to look.
Great.
I think that's better than 283, whoever it is, pages before clinic in the morning.
That's good feedback. I'm going to, I'm just looking at the time, and time is ticking on. So I'm going to put in another question here. I'll start a fresh chat so it's not so crowded in there. Again, I had better pull I'll pull the guidelines into this, and I'm going to ask it to evaluate a scenario, prenatal alcohol exposure. Just give it a few seconds to load that again. Prenatal alcohol exposure obviously is above a low level. And while these answers may not be definitive, they do show you how the guidelines might be applied. Okay, it's giving us a nice rating. PAE is confirmed. It is above a low level. It discusses the impact of timing, the reliability of the information, and it says, yes, it does meet criteria. You could do the audit C. I'm not sure exactly what score you would get. You could ask AI to do it, but in the interest of time, I won't do that, but it's certainly something that you could do. I've run a few different scenarios through this, and I'm finding the results pretty good. I won't do them all now because I want to get to another topic first, which in the remaining time, which is looking at patient information. We've probably covered off on this enough that, you know, ChatGPT is not particularly safe. Copilot in a work environment is generally very safe. So I recommend de-identifying reports if you're not using a really secure thing. Test scores can be, I think, safely uploaded as long as there's nothing to identify the person. But obviously, you know, use your own clinical judgment on that. I'm going to swap back now, and what I've got here is a completely fictional report that I have made up. For a child, it's a FASD assessment. I'll show you quickly what it looks like. This is a child called Lucas. He lives with his aunt, he's 7, he's not Aboriginal, he was assessed by a team. It's got his background, typical things that you would see in a FASD diagnostic report. The detail's really not that important for what we're doing. What I'm going to ask it to do is to summarise this. Just going to find my prompt and I'll just write it in. Summarise this report into a parent-friendly version for Lucas's aunt. And this is where I think AI is really helpful. It talks about that he meets the criteria for FASD. These are areas he struggles with. It talks about some of his strengths. Talks about how his brain works differently. And it gives a breakdown of the sorts of supports that he needs. Obviously, you would want to sit down with the full report and just check. But given that AI is really only drawing on what you have uploaded, I think it's probably pretty accurate. What I might do though is say that, let's say that Lucas is an Aboriginal child and lives with his grandmother. Can you write a report that is a report for his grandmother? And what I'm going to do is refer to the Indigenous framework, and I'm going to drag that in super quick. Oh, where is it? Is it not in my list of things? I've uploaded this before, so I'm going to take the risk that it can remember it from another session because it is the paid version. It's saying this overtly. I probably wouldn't put that in there. But we're now getting a version of this report that is a bit more nuanced. We're talking about Lucas's story instead of his diagnosis. It's situating the carer's role and the role of family as primary. It's giving a similar explanation of his difficulties. It goes through his differences. Now, again, it's specifically quoting this, which I wouldn't do, and it's probably a fault in the way that I put that prompt together. It's referencing it instead of using it, so that's my bad. But it does give a lovely sort of summary here. Well, to me, it looks like a lovely summary. But Nick, I would like to get your sort of feedback on this sort of interpretation that AI has done.
Yeah, it's good in terms of giving some prompts and reminders and considerations, but probably similar to what Julia was talking about, it doesn't actually provide the doing. And I think, you know, it's very easy to say provide a culturally safe environment, but the issue we have in Australia is the practice of that and what a culturally safe environment is. And because that differs, because culture differs from family to family. That can be very hard for AI to sort of capture. And the other issue sometimes we find with AI is that many things have been written about our people and in a deficit way. So sometimes AI will draw upon the more deficit narratives, which aren't the appropriate ways to communicate. But in terms of giving you a little bit of like, okay, what are some prompts? But I wouldn't rely on it. I think we can dangerous sorts of practices, and which many Aboriginal people have issues with, is when we reduce things to a checklist. And
absolutely.
As long as I do all this, I'll be appropriate. Because also what our FASD Indigenous framework really encourages is that, while we can tell our grandma all these things, it's not giving her the skills in which to navigate and support her child with it. And also she will need to advocate, everywhere.
Yes.
When we get a diagnosis, it is a shit fight from then on, like with with NDIS, and we've got additional barriers. Like everyone has barriers around that, particularly if you've been diagnosed with FASD.
Yeah.
But obviously they are exacerbated for Aboriginal people. So when we talk about those structural barriers, we have to, understand that someone needs to walk alongside our families after the diagnosis, and that's probably more critically important than anything else. And how do clinicians, how do health professionals understand what is going to be appropriate, who is going to be appropriate to walk alongside the journey, and to continue explaining what the diagnosis means for them, because there's a lot of information to provide a family.
It is.
Any family.
It's a lot.
And a lot of our families feel discarded once they get a diagnosis, and they are left to just, navigate it themselves on top of everything else that they grapple with. So I would
thank you.
Great as a guide, but I would always air caution around leaning on something that hasn't got enough voices from our people.
Absolutely. So I think what I'm hearing what I'm thinking when you're talking through that is the individuality of it is very important, but I'm wondering if we can do more work in the future to find ways that, not for AI to write stuff, but to save time in rewording things that we have already written, that we have sort of for different purposes. For example, in advocacy, you could turn something into a letter for grandma to take to the school, as long as it's based on targeted and real, accurate information and the right language, because I still think that it can help save time in some situations.
It absolutely can. And one idea might be, Annette and Julia touched on, when you're talking about, to families around the diagnosis, and around like how functional impact might occur. Relying on AI to come up with metaphors to then articulate, so to give a visual kind of would be really useful, as well as perhaps a visual aid if if you've got about as much creativity as I do, which is likened probably to a gum tree. Something like that might be really helpful in order to explain in a different way that hasn't got that clinical jargon and underpinning.
No, I think that's really true. Thank you, Nick, for that. I think it's something we can, like anything, it's a very blunt tool at the moment, and I think it's about whether we can make it something that helps or not. We're about to finish up. I'm really sorry about how quickly we've gone through everything. Quickly, a comment on environmental impact. And while we're finishing up, please put any comments in the chat. We haven't had a lot of questions from everyone. I hope that's because you're just so captivated by this information, but I also hope it's not because you have dozed off. So please let us know any questions or thoughts you have. We have a parent workshop coming up in 15 minutes. Some of you may also be attending that, and we'll try not to repeat too much. But AI does have an environmental impact. It's difficult to know exactly what the ongoing impact is, because a lot of the data about how much energy it uses is based on its training time. A lot of energy went into training the AI tools, but there is no doubt it is sucking energy. I think sometimes we forget that Google searches also take energy. So, 10 Google searches to 1 AI search may end up balancing out, but we can be selective and, don't do things unnecessarily just for the fun of it. Avoid uploading large files that don't need to be processed. I've probably uploaded some today that I didn't need all of them uploaded. So it's really just using it wisely. And just a few takeaways here. It's a tool, it doesn't replace anything. The prompts really make a difference. We can use it ethically and de-identify information. But I'm really interested to hear, how people are using it. Erin's put a comment in the chat that she's using Notebook LM Google to digest the guidelines, and that can turn your chats into a podcast which you can listen to, which I love that idea. If anyone else has any thoughts, please pop them in the chat. I do want to thank all our panelists. I might hand back over to you, Viv, to finish up.
Yeah, thanks so much, Prue. I just really want to say we have already had some really interesting recordings and resources that are being developed on our website, and I'm going to put that into the chat. So please stay up to date. Take a moment to sign up to our mailing list as well. I'll put that in the chat as well. Like I said, this is the first of our webinar series, so we'll have more coming, and a lot's going to be happening in this space over the next couple of years. So yeah, we look forward to keeping you up to date.
Thanks, Annette, Julia, Delise and Nick for contributing today. Really appreciate the time out of your busy, busy days, and hope it's been useful for everyone.
Thanks, Prue.